employment, and we have a lot of small businesses in this country and self-employed people who don't have business-sponsored, employer-sponsored health insurance. They don't benefit from that $240 billion that you're talking about. They have to pay
they get no help.
out-of-pocket after-tax dollars for their private insurance. It's not fair. It is
really
not
unfair.
equitable. And I think some of the things that you're saying aren't bringing us towards a more equitable system. Isn't that important?
Well, I think, well, let me talk about this point about equity and then maybe get to the bigger philosophical issues. If I wasn't clear, let me be clear. I think our healthcare financing system today is very inequitable. If you think about where the subsidies are going, that $1 trillion plus that the federal government is already spending on healthcare, it is not, if you just grab someone on the street, maybe you, I don't know if you'll agree with this or not, but when I talk to students or other colleagues, the first thing that, and these are people who don't specialize in healthcare, don't think about it every day. The first thing is, what should the federal government be concentrating its money and its efforts on? It's first and foremost on people with limited means who have the most trouble getting access to care and affording it on their own, and people with chronic diseases, people with high healthcare needs who are going to face very high costs if they don't get help. That is not where the federal subsidies are concentrated in our system today. As I talked about earlier, particularly the tax subsidy, but not only that, the Medicare subsidies as well, as John Skinner, who's in the audience, knows, tends to go to people who are higher income, who live longer, and who have access, even within a government-run health insurance program, to more intensive, costly approaches to treating some of the conditions that they have. So absolutely, I agree with you that we should be reforming the way that the federal government subsidizes health care to first and foremost concentrate our limited resources on the people who need it the most. Now, there are these big philosophical questions about whether we should be doing that in the context of a single-payer, a government-run system, or a competitive system. And maybe I've been in Washington too long, but the focus there, I have to tell you, is that no one in Congress expects to bring up to a vote in the next year, the next 5 years, the next 10 years, a single-payer system or a single or a across-the-board competitive system. Yes, there are those proposals out there on both extremes, but nobody expects that that's going to be what happens anytime soon. Where a lot of the attention is focused is on more incremental steps that could lead to more fundamental improvements in the way that healthcare is delivered, starting with the people like you were talking about in small, who are working for small employers that aren't lucky enough to get health insurance on the job and who are getting absolutely no help in either subsidies for their coverage or in access to a low-cost system for choosing their coverage. And so that's where a lot of the efforts are being concentrated right now to try to improve access to care. And with respect to the question of, philosophically, what